Any other questions?
I was diagnosed with some blood clotting disorders, and I wonder, does that have any effect on my levels of hormones? Do I have to be concerned about, if my blood's getting too thick, if I have any problems, or should be concerned about getting, my hormone levels tested because of that?
The question is, you have high blood concentration now, your blood levels, and whether or not you should be concerned about your hormone levels, so that being a possible cause. It would certainly be, a consideration in initiating any therapy for sure. Something is certainly stimulating the bone marrow to be making more of something than it should be. Could it be a deficiency in something? Could it be your testosterone being too high, your estrogen being too high? And when you're looking at replacing something to a level that would otherwise be normal, if you observe there's a deficiency in one of the hormones, you certainly want to look at replacing that to a level that would be considered normal, because then you're hoping whatever that deficiency, maybe that was part of that cascading of things that is leading to the condition that you have. One of the nice things about having a compound pharmacy and the questions that come from patients is all the interactions with all these other medications. And certainly you can take too much thyroid and you can be all, or you can have too little thyroid. But when you're replacing, and does it mix with this and does it mix with that, if you're bringing something that's deficient, like a thyroid, kind of like with insulin, if your insulin's low and you bring it up, you get back to normal, that's where you want to be. So the interactions with other medications, the interactions with this and that, really is, I don't want to say inconsequential in many regards, but yeah, you certainly would want to get a hormone panel and see what, what some of those levels are.
Actually, if you've got a clotting disorder, you can't take hormone therapy.
No.
Not at all.
Not at all. Which estrogen would be the primary no-no with clotting disorders, correct?
So then what happens in that case then, if you realize that you are deficient in certain hormone levels as you approach menopause and you have blood clotting disorder?
I'm going to let Dr. Ellis answer this one.
Get all the easy ones.
No, come on.
If you've got a hormone, if you've got a clotting disorder, and it depends on the type of clotting disorder that you have, and whether you're heterozygous or homozygous, okay? And if you've had clots in the past, you can't take hormone replacement at all because it increases your risk of clotting disorders as far as DVTs, which is deep venous thrombosis, and pulmonary embolisms. So those are contraindicated to anybody who has clotting disorders.
Okay. Any others?
Hi, Ray. My question is going to be directed to Dr. Ellis.
I asked him to sit up here at the front table. He didn't want to, right?
Yeah, his name was on that little sheet of paper I got in your office. But is he an internist and doesn't take a special interest in the hormones, the compounding hormones, more so than a lot of the other doctors in town that just blow us off with the saliva tests and think it's kind of weird science? Dr. Ellis?
So, and the question is, has he taken interest in this?
Is he an internist that has taken a special interest in this? Is this why he knows you, Ray, and is here to answer our questions tonight?
Yes, I am an internist, and I'm board certified in internal medicine, and I did take a special interest in this, and I've been prescribing hormone therapy for a bunch of my patients.
Can't hear you.
It's dead. Oh, no, it isn't. Okay, I've been prescribing hormone therapy for a bunch of my patients.
As as I'd indicated in the opening, we just do not have those, and I've talked with many of you. Well, who can I go see? Well, I know a doctor in Canton, and I know a doctor up in Cleveland. I know one in New Philadelphia and near Pittsburgh that we're interacting with. If you want to drive an hour, we don't have anybody in the area per se that is willing to really look at some of these things and help. And we're very pleased to have Dr. Ellis, you know, to open up his practice, which he has been doing, and make everybody aware that he certainly understands the issue and is willing to treat.
Is he local?
Right on 224, just past West Boulevard, SANW that I heard closed. Down heading towards Canfield. Yeah. Yeah, so if you're heading towards Canfield on 224, go past, cross over West Boulevard, and it's a couple of streets down on the right. Mm-hmm. Okay?
I just want to ask, so
Sure.
if a physician doesn't do the same method that you do, the compounding pharmacy prescribes estrogen replacement for a woman, tell me how different that is from what Dr. Ellis would prescribe as his hormone.
Well, really doesn't, the physician, as far as my role is to dispense what is prescribed by a physician. I have really no authority to give anything to anybody if I don't get a piece of paper saying Dr. So-and-so said this is in your best interest. So my role in all of this is an education and to help facilitate some of these things. But you have to...
If a normal, I mean, if a regular physician prescribes hormone replacement therapy, they don't go back and check the levels, or they don't do some kind of blood work to tell you what the level is initially, right? Isn't that
Yes.
the difference between what, no, that's not the difference.
If you're going to get hormone replacement from a gynecologist
Okay.
or whoever it may be, they're going to do levels. Okay, for instance, if you're a man and you come in with for blood work, complaining fatigue and weight gain and et cetera, you're going to get a testosterone level. You don't get a testosterone level without PSA, okay? Because you have to watch the PSA. And then you do an FSH and an LH to make sure that you're not dealing with a secondary type of hypogonadism versus a primary type. And you sort it out. And then you order your meds accordingly. And in 6 months, you have to recheck your levels. You have to check liver enzymes because of the risk of hepatocellular carcinoma. Okay, and you got to check the PSA because of the risk of prostate cancer. So it's just not writing a prescription and forgetting about it.
Well, that's what I mean. I was
Right.
the gynecologist who gave me hormone replacement therapy for years and years, and I never
That
had
was
to
the
do
old.
that.
That was the old.
Mhm.
That was the old school.
Okay,
Okay, the new school is you got to do levels.
everybody has to do levels now. Okay.
Yeah, because of the risks
Mhm.
of using the drugs. Okay, they're not without risk.
Sum it up, Ray.
Yeah, the question was kind of how does the process work? And as Dr. Ellis explained, the physician will order blood work, see what your levels are, order some kind of replacement, and in 6 months those levels get checked again and see where you're at. Adjustments are made, and sometimes this will go on, I don't know, for a year and a half or 2 years until everything gets tweaked correctly. Every female is different in the amount of estrogen that she needs, amount of progesterone, so it could be a frustrating period until you get it to where it needs to be, but then usually once you have it, you pretty much have that mix that that individual requires. Did that help answer? Okay. Rulon?
I thought that Dr. Canby was also interested in this.
Dr. Rulon is asking about Dr. Canby. Dr. Canby does do hormone replacement therapy. OBGYN, Dr. El Hayek and Dr. Winchester also do. Mm-hmm. Okay. Okay. Thank you all for coming. And one more.
Some types of breast cancer require a medication to deplete estrogen. But when you check the side effects, the list of side effects is sometimes overwhelming.
Right. Tamoxifen, anti-estrogen, similar to the anti-testosterone chemotherapy drugs that are given to patients that have been diagnosed. Depending on that particular breast cancer and what it's actually receptive to, there's different types. So what is said here does not, cover all the different aspects, but definitely the goal is to block the amount of estrogen that would be exposing that breast cell to more stimulation and more growth. Okay.
Thank
Oh, sure. Absolutely. This is Kelly Connors.
Hi. I have not been feeling well for quite some time. I have a very dear friend in Cleveland that's Kelly. She told me this 2 years ago. You need to call Ray Carlson. I think you really need to talk to him. I waited a whole year. By then my hair started falling out. I was just inactive and I felt very ill. I went in to see him. He counseled me for about an hour. I got a saliva test. He recommended a physician to me. They did my blood work. By that point, I had 1 point of progesterone and double the estrogen in my body that was healthy. I'm 45 years old. My mom had 2 kinds of breast cancer, and both breasts removed, one in her 30s and one in her early 40s. So now I'm ready to get retested again. But my hair is coming back, my energy level is better, but I feel like I have a ton of testosterone in my body. Actually, I'm raging and I'm having panic attacks a lot, so I don't know if I'm quite regulated right now, but I feel so much better than I used to. So that is the process. And I did have to get the saliva test and the blood work before I can get my everything going. So, but it's been a lifesaver for me. I so appreciate you.
Oh,
You're dear to my heart.
Thank you. Kelly, by the way, has a beautiful voice. If you happen to see her out somewhere playing, check the newspaper, check the absolutely beautiful. And I thank you for that very much. Okay, thank you all for coming. I enjoyed it. Appreciate it.